good afternoon, good evening, wherever you are tuning in from. Welcome to another episode of Oche Kitchen Discussions. Today we're going to talk about breast awareness. But before we start, please, like Irani, if you like us, please go to our YouTube channel, our Facebook page, Instagram page, like us,
Click.
subscribe to us, smash any button you see there, whether it's thumbs up, like, whatever.
Like,
Just smash the button,
subscribe.
okay?
Yep.
All right, thank you. Right, today we're going to talk about breast awareness. Why are we talking about breast awareness in February? It's not October, because every one of us have been affected one way or another. We all know a sister, cousin, auntie, mother, friend, or a friend of friend who had or is going through breast cancer. According to the National Breast Cancer Foundation, 1 in 8 women will develop breast cancer at some time during their lifetime. Anyone can get it, including young women and even men. Benson, did you hear that? Even men can get it, but it predominantly strikes middle-aged and older women, with thousands facing an invasive breast cancer diagnosis this year alone. It's crucial that we all do our part to help get the word out about it. Joining us today to talk in depth about this is a friend of the show and our sister, Dr. Fiola Obi. She will answer your questions after. All right. Thank you, Fiola.
Welcome, Fiola. Thanks to have you.
I take you away.
So, did you mean that anything that has breast has a potential?
Men,
breast.
Yeah. Even dogs, even animals have, right, Fiola,
breast
right?
cancer. We'll hear from Fiola in a minute.
Anywhere there's breast tissue, breast cancer.
Exactly.
Thank you.
Okay, so hello everybody. Nice to meet you all. So my name is Fiola, and I'm a doctor. So I mean, Pam really hit the ball. I think you hit the nail on the head. I think breast cancer is something that is very sensitive. It's very important. And the reason is that once a doctor starts drawing attention to your breast for one reason or the other, the first thing that goes off in your head is, oh, breast cancer. Okay. So, and that statistics that Pam mentioned is actually very crucial. So when you hear that 1 in 8 women will have breast cancer at some point in their lives, what do we mean? So let's say there are 8 of us here having a talk, having a drink or something. Unfortunately, one of us will get breast cancer at some point. Okay, so it's a small number, and it's quite significant. And we're talking any time in their life. So it can be any time from, early 20s, 30s, up to 70s and above. It can happen at any time in that person's life. And also, it's very sensitive because it's, just like the other cancers, if you think about it, there will be somebody in your life that has been struck by cancer. Let's narrow it down to breast cancer. It could be your mom, could be your grandma, could be your auntie, your niece, your sister. And then even if no one in your close, your inner caucus, yes, you will know somebody that knows somebody, a friend, a classmate, a friend's mother. It's not a stranger to us. Okay, it's almost like, hey, oh, you hear somebody, somebody's been given a diagnosis. It's no longer, it's bad news, but it's no longer this is like again. Okay, because you will know somebody. All right. And personally, speaking from my own personal experience, I have lost 2 close friends to breast cancer. Okay. And what makes it very sad is both of them died before the age of 40.
Yes, it's true.
Okay. So don't think that you find it's commoner as you get older, but it's a deadly disease and it can strike anytime. Okay. So with your kind permission, Pam, Ify, OJ, I would like us to dedicate this episode to those women, okay? Those women out there, dead, alive, fighting. Let's dedicate this episode to them, okay? Because it's actually a battle. There's a war out there. And, these women, where they fought in this battle, whether they were successful and they survived or they lost and are no longer with us, it was a battle, all right? And if they are still fighting that illness, whether they're undergoing chemo or radiotherapy, it is still a fight. It is still a battle, okay? So why am I calling it?
Some go to Odumeje too. Some go to Odumeje.
To be honest, when there's war, you pull on anything you can to fight it, okay? The Biafran war, what people use all sorts, Obunigwe and all that, whatever you have, that the important thing is you need to survive, you need to win. So whatever you can use, all right? So, but I want us, I want to use the analogy of war for this, okay? Because any one of us may get it. Yes. And not just us, just like, you said, men can get it as well. All right. So don't think it's just a disease of women. So, the figures we use, that you have 8 women, 1 is likely to get breast cancer. Why is not so this thing with men is that the figure is slightly larger. So some studies have 1 in 100. Some go as high as 1 in 140. So
for men?
Again, yes, for men. So you line up 100 men or 140 men, 101 will get breast cancer. But if you compare it to lining up 8 women, you can, yes, you see. So that's why it looks as if it makes sense to be more concerned for women, but it is also as deadly in men. And because it is it's so rare in men, it is easily missed. Okay, so by the time it's found out, because it's the last thing that will come to their mind,
yes,
it becomes very deadly, very too late. Okay, so again, going back to this my battle, this my war and all that, in this warfare that we are in now, we are the soldiers. Okay, so well, I don't know about other countries, but I had a colleague when I was in training who was what's called a reserve army. So he's actually a trained soldier, but he was also a doctor. We were doing a postgraduate training together. And you see him with his cane coat and all that. He was always on the ready. He was working as a doctor, but he was always on the ready because he could be called upon anytime to go to war, okay? So we are this army reserve now for this war that we're talking about. Because once you get this diagnosis of breast cancer, the battle line has been drawn, okay? You are now going to fight, okay?
Big one.
Yes, big one. Going to war is not easy, all right? So, but just like in the 100 years ago, you are called to war. You are forced to conscript, they'll call and you must go to war and all that. I remember, yes, drafting, conscription. And I remember mothers will start crying because it's like a death sentence. Once your son is going to go to the war front, you think the worst. Am I ever going to see my son again? Okay. But it's not really the same now. Warfare now, not every soldier is going to die. People can fight remotely. They use drones and all that. So what am I talking about? I'm talking about advances in science, advances in medicine. 20, 30 years ago, a woman gets a diagnosis of breast cancer. It's a war.
Yeah, death sentence.
Exactly. It's the end of the world. Okay. So, but it's not so much so now. All right. So why is that? If a woman gets a diagnosis of breast cancer, bearing in mind how early and goes through the treatment processes and all that, the chances are that, again, coming to numbers, if you had 5 women that were diagnosed this year with the treatment, with advances in medicine, advances in science, the chances are that 4 out of these 5 women will still be alive in 10 years' time. Okay. And that is fantastic.
It is, yeah.
Yeah, that is fantastic news. All right. But there is a reason for this. And that is why we're here today. There's a reason why these numbers look so promising. And that's why, you know, I like this our setup. All right, Pam Pam, Ify, Oja, I like this Oche kitchen setup because it's not like you know, I'm giving a lecture, I'm using a projector, I'm using PowerPoint and all that. In my mind, we are literally sat in a kitchen having a chat. Okay. If Oma got some stuff, somebody sent parcel with so she's cooking for her for us. Okay.
We are waiting.
Pam Pam is plucking the oha. OJ is sorting out the crayfish. We're just there sitting doing this and then talking about this issue, okay, and bearing our souls, talking about it. So, and then I think it draws it to heart, because then you think about it in out of the box. You think about it on a personal level. You think about it on a family level. Because when it's so formal and somebody's bombarding you with figures, with statistics, with this, it goes in one ear and goes out the other ear. But when you're sat like this and you're talking, it sort of like takes root. And that is why I like this setup. So there is a war out there. We have to prepare for battle because we're these reserve soldiers, okay? And the fact that we're reserve soldiers does not mean that we were there for nothing. We have been trained. Yes. So once we hear that, get that call, we are out there. It's not that we're going to start training then. The training has been done already. And we are prepared for the day we are being called. Okay. Yes, so that is what this is all about. We are in training now. Okay. So this training is, we need to know what makes us prone to breast cancer. Whether we like it or not, it's there. But it's not written on our faces that Miss A or Miss B will be the one that'll get it. Okay, so how do we get prepared for, in case we are not called up? In case, so how do we get ready? So the things that will get us ready, in medicine, we call them risk factors. What are those things that makes Miss Jane more likely to get breast cancer over Miss Ada? Okay. Yeah. Remember, we have this line of 8 women. So how do we know that number 1 or Miss A would get it other than Miss C down the line? And it is because of these risk factors. Okay. What are these risk factors? So the first one is age. Just like most cancers, the older we get, the more likely we are going to get a diagnosis of breast cancer. Yes. And the line is actually about age 50. All right. So once we get to age 50, we are at more risk of getting breast cancer. But for me, the most important risk factor for breast cancer is a family history. Yes. Okay, it's a family history. If you have a family history of breast cancer, and we're talking, the nearer the relative, the higher the risk. Yeah. Okay, so if your mom had breast cancer, your mom's sister, so your maternal aunt had breast cancer, your sister, your daughter, God forbid, the risk is higher. So, and why am I saying this? It's to draw your attention, to make you more aware. Okay.
Sorry, Fiola.
Okay. Yeah. So I'll tell you a short story. Okay. Remember, we're chatting around the kitchen table there. There's this woman. She went, okay, she examined herself and she found a lump, and she went to the hospital, and they did the scans and everything, and it was found to be breast cancer. Okay, they then told her she needs to inform her relatives, her sister, her mom, and all that. So she informed them. She had one sister. So her sister checked herself and said she can't find anything. She went to the doctors, they examined her, they couldn't find anything. But because of the type of cancer her older sister had, she had a mammogram anyway, like a tick box thing, that they did something. And on that mammogram, that's where they found the breast cancer. Okay.
Oh my God.
So the point I'm trying to make is that if her sister hadn't had that diagnosis, she would never have gone that extra mile to get herself checked. All right. And unfortunately, the sister that had the initial diagnosis had the lump taken out and survived. But this second sister who it wasn't obvious, that ended up having it found on the mammogram, ended up having a bad cancer that spread, and she died.
Oh, Lord
Okay.
Jesus.
Yeah. So these are the risk things that I'm talking about. You just let your antenna let them just be there. If you hear that someone in your family, just be a bit more self-conscious. Okay. So closely linked to family history is what we call genetic history. All right. And I don't want to go into so much detail, but the one we're most concerned about is this gene called the BRCA2 gene.
Yes.
So if for any reason you had a genetic test or whatever, and you found to have the BRCA2 gene, you are at a very high risk. And that is why a lot of women, you hear about people like Angelina Jolie and co, going to have a preventative double mastectomy, because that gene is very high, it's a very high risk thing. So it's something to bear in mind, okay? Another risk factor is hormonal issues. So the breast tissue is very sensitive to hormones, okay, especially the female hormones. That is why, when you, for example, during puberty, when everything is up and down, you see young girls complaining how sore their boobs are, or just before the period, or when you're pregnant, you're breastfeeding. All this surge in hormones makes the breast, sensitive. They're so, tender, more, obvious. And then just the same, when you now go through menopause and the hormones start dropping, the breasts are no longer as voluptuous as they used to be. They start to sag and that, you know what I mean? So hormonal factors are a big deal. So unfortunately, you are at higher risk of developing, not very high, but it's something to be aware of having breast cancer if you started your periods very early. So we're talking people that started periods.
Say that again. When you were talking about hormones, I wrote it down to ask you later, but repeat what you just said.
So I was like, unfortunately, if you started your periods very early, you're at a higher risk of developing breast cancer. Very small, but it's something to be aware of. Okay. And that's because the breast tissue is being exposed to the hormone much sooner. So we're talking people who start periods at 9, 10, 11, okay, compared to the average of about 12, 13, 14. Does that make sense, Papa?
Yes.
Yeah.
Because I heard early pregnancy reduces your chances too.
Yeah, because when you're pregnant, no periods, right? You're going to go through a time where you won't have any periods because you're pregnant. And the same with late menopause. So we're talking women who, after the age of 50, they're getting on 53, 54, 55, Average age for menopause is about 50, but these women are still having periods then. They are at risk as well. All right.
Oh, wow.
Yeah. Being on the contraceptive pill, the combined one that has estrogen for a long time.
Oh, Lord Jesus.
Right?
I have IUD
Yeah.
for like.
No, IUD is fine. We're talking the pill.
Oh, okay.
It has estrogen, or those women that go on HRT for menopause way, way, way late into their late 50s. They're still carrying on being on HRT for like more than 10 years at a stretch. Okay, so these are very minimal risk factors, but they're worth being aware of. All right. A big one for me, smoking. Smoking is a big deal with all the cancers. If you smoke, the best thing you can ever do to yourself is to stop smoking. Smoking is implicated in every cancer, including breast cancer. In fact, I cannot tell you one benefit of smoking. I cannot tell you one good thing smoking can do for you health-wise. All right. Unlike alcohol.
It moves your bowel fast.
You reckon? There are other things that can move your bowels faster. Okay. I eat pawpaw very well and you will go, you know. Unlike alcohol in small quantities can actually be beneficial. Yeah, all right. Yeah. But excessive alcohol, again, is a problem in cancers, in breast cancer as well. Another risk factor, and I think this is important, is actually our weights. The more overweight we are, the higher the risk. And it's not necessarily a direct link. I'll come to where weight comes in more detail, as we go on. The way I look at these risk factors is just like with a lot of things with life. There are things you can help, things you can take control of. And there are things that are beyond our control, things that we cannot do anything about. So, for example, whether we like it or not, we can't do anything about our age. It's one thing that will always go up and never come down, okay? So you know how we said the older we get, the higher the risk? We can't do anything about that, okay? We can't do anything about what age our period starts. And we can't do anything about when our periods will end, menopause. We have no control over that. But we have control over whether we smoke. We have control over how much we'll drink, alcohol we'll drink. We have we have some control, despite what people think, on how much weight we put on. If you want to take it seriously, you can sort out your weight, okay? So...
And control about how well you eat too.
Yes, definitely. Your diet, your lifestyle, these are controllable factors. All right. So we can't control our family history. We can't control our genes. All right. So if you're ticking all those boxes, family history, genetic history, you had early periods, you're going through the menopause very late. Why do you want to complicate it and add to that scale by smoking, by drinking, by, you get what I mean? So it's important to mention these things. The trick with breast cancer, like most cancers, so you may tick most of these boxes. You can't do anything about it. You have a family history, you have the A, B, C, and all that. But the trick with breast cancer, again, another weapon in our arsenal, remember we're these reserve soldiers in case we're going to be called, is early detection.
Yes, sir.
Okay. Early detection. So the earlier this thing is detected, the better the outcome. The better the outcome, okay? And this is a testimony to those women that we're dedicating this episode to, because these women that have gone through this, when you think about chemotherapy, radiotherapy, and everything they've gone through, most of these things are done through trials. So what I mean by trials is that they get diagnosed, they try this combination, they try that combination. And remember, these are women that have nothing to lose. So they don't know if they're going to be here next year, next month, whatever. So they would rather try that medication. And they go through a lot. If you see what women go through with chemo, but as each year goes by, they refine this medication. So the chemo that was used 20 years ago is not the chemo that was used 15 years ago. It's not the chemo that is being used today. They're going through all these things and the outcomes are getting better and better and better.
Hallelujah.
So, yes, so this is a testament to them. They've been like, pardon me for using, they're like guinea pigs. Yeah. And they have done these for us. Yes. They've gone through all that for us because they've gone through and the trial and error, they've found better medication and all that, which we can now use with less problems than they did. Okay, but why would these things be effective? How can they be effective? They can be effective if these cancers are detected early. That affects the outcome. That those 4 women that would survive in 10 years' time, it wasn't like that before.
Yes.
Okay, and if we carry on, 5 of those we are 5 out of that 5 women, why can't they be alive in 10 years' time if we put all these things into practice? Okay. So one good way is of early detection is screening. So screening means you go for a test to prevent, to pick up something early. You don't wait until you get a symptom or whatever. And most countries have screening programs in place. So we're talking mammograms, where you then go and have these special scans that checks your breast tissue. Okay. So Pam Pam, in US, do you know what the screening program is? I'm not familiar.
Yeah, we started 40 years. 40 years, yeah.
Oh,
So for
that's
somebody
good.
like me, yeah, I had the first year I went there, they figured that I had dense breast.
What does
So
that mean?
for me, I do both the mammogram. Subsequent years, I do both mammogram and ultrasound.
What's
Good,
that
yeah.
breast, Wapa?
Yeah.
It just means it has more breast
But I have
tissue.
more. Yeah. So it has more tissue than fat. Don't worry, fat. Alpha gada. Don't worry.
Happy for
So
one machine again.
Bobby, my friend, is actually here. The first time I got that report that I had dense breasts, I was like,
Oh,
"What is it?"
dense. Is it
Dense,
dense?
yeah.
Dense, heavy,
I thought you
heavy,
said dead
dense,
breast.
No,
dead.
dense. So I
Can
was
we
Yeah.
see? Can we
so,
see?
yeah. So anyway, you've seen my breast from nipple to now. So
Aspect
anyway,
of the
so I
two.
called them.
In
I'm like,
Rose house. If I'm you saw it in Rose
exactly, don't
house
find me in
during
the back.
shower
So
time.
I called the hospital. I'm like, what is this? What is dense? Dense. So
Yes.
I was going online. It didn't make sense to me. So she now explained to me that I should dense breast is like croissant. Like, you know how you open the croissant, it has those things. It means like
Rolls, yeah.
you have more muscle.
Yes, yeah.
Then regular fatty breast is like white bread. That's why they fall flat. Okay, so
Okay.
I'm like, okay, I'm good. Continue. I want to say something. I had a friend who had she died from breast cancer, but hers wasn't on her breast. She had a boil. So for people who self
Examine.
Yeah.
yeah, for us women, please, if you get boil, go and check it out because we might be saying
Yes.
it's boil and be treating it. Yeah.
Yeah.
Once you finally
Yeah.
went, we found out that so some of them don't grow around the breast area, they grow under your armpit. So
Yes, that is a very
extent,
yeah, it's
yeah.
very important. Yeah.
Yes.
Yeah. So this thing with the
Oh, somebody Vera at the Sogon said my mom's was in the armpit too.
caliber.
Hey
Yes.
Vera, how are you? Welcome to the show.
Yeah.
You
Yeah,
talk.
that's very important.
Yeah, Vera, can you share a little bit? Yeah, go ahead. Fiola, do you mind? You don't mind, right?
No, of course. Vera, go on.
Vera, don't be
Yeah,
shy.
sorry, I was going to say my mom's one was in her armpit. It's still fresh because she passed away only a few months ago, so it's still nice and fresh. But
Sorry.
yeah, and she just thought it was the boy.
Boy,
She
yeah.
just thought, oh, boil, and by the time it got picked up, there was nothing they could do.
Yeah.
At what age was this, Vera?
You said that, I guess, sorry.
At what
How
age?
old was mom?
69.
Yeah,
My
sorry
friend
about
was
that.
under
But
40
then
years
I
old.
suspected it because my grandma died of breast cancer, so I suspected it was, but she was adamant that it was just a boil. But yeah.
Yeah.
And she didn't have any symptom at all. She was not poorly at all.
Wow.
So
it was too
Vera,
late.
that brings us to that thing about family history. So you're ticking a very big box with family history because if your mom and your grandma had that, unfortunately you are at high risk and you should be very self-conscious because you're ticking some boxes. Okay. Yeah. So we'll come to the boil things and what to watch out for. Going to the UK. Unfortunately, well, I don't know if I'll say fortunate or unfortunate, but because they tend to say that it's more common after the age of 50, the screening program starts at 50.
I'm getting there. Yeah.
I think in countries like the US
yourself, mom.
in countries like US and Canada, lots of these things, it's part of their private healthcare package. So it's part of their this thing. So yeah, but we don't really have that in the UK. We have the national health. So unless you want to go out of the national health program, you have to wait till you're aged 50, where you get a letter in the post, and then you are called up to go for the screening. So again, it's a mammogram. Yeah.
Question: if you have family history, do you still wait till you're 50?
So if you have family history, it's kind of different because now you can go, there's something called the family history clinic.
Okay.
So if let's say a member of your family, your mom, remember what happened to this lady I told you that her sister got it. So because it was this thing and the type of cancer, it was found to be one of these genetic, family. So yes. So they asked her to get her sister, her mother, and that was how, remember that story I told you. So they then go through a different route. But for people who don't, or if like you're young in your 30s, and we'll come to that, you do not have to wait for the mammogram. That is why we have to get our weapons ready, because if we wait till we're 50, lots of things can be missed. Okay.
I swear.
Yeah. So in the UK, yes, once you get to the age of 50, you get a letter in the post, you go, and it's every 3 years after that to your age 71. Okay. So the $1 million question is, what about us that are not yet 50? Okay. What are we going to do? Are we going to wait? So we have to be proactive. All right. And not just those of us that are not yet 50. What of us, our sisters, our friends, our family in countries like Nigeria that have no healthcare at all? Okay. You have to do things you have to know what to watch out for. You have to, know what you're doing. And the greatest weapon in our arsenal for this war, for this battle, is self-examination. Okay, self-examination. You have to take responsibility for yourself. Okay, don't wait for the screening program. Don't wait for the letter to come in the post. You have to watch out for yourself. And my question now is, how well do you know your breasts? How well do you know your breasts? How familiar are you with your breasts?
Very important.
So very important. And remember that we talked about, breast tissue being sensitive to hormones, and at various times of our lives, but also at various times during our cycle. So the breast will never feel the same when you are not pregnant. It will feel different when you're pregnant. It will feel different just before your period. It will feel different during your period. It will feel different after your period. You have to be conscious with your breast. You need to know what's happening with it. So you need to know what your breast feels like normally at various times, so that you can be able to identify when it is different, when something is changed. Okay. So this is a normal thing for medical students. They always tell them, before you examine, somebody has a problem with his eyes, there are two eyes. You have to start with the first eye. Check what the normal eye looks like first, before you go and look at the one that has the problem. Why is that? So you can identify what the issue is. You don't go straight to the, yes. So you need to know what your breast looks like normally, so that you can know when something has happened. Okay, so that is why we're here today. Self-examination. How many of us, show of hands, self-examine? Ifeoma.
I could tell you, like, maybe I may have not said this to you, or you may have forgotten. In 2007, while we're still in Nigeria, because we keep going through this medical encyclopedia, we had a big library.
Dr. Google.
They go on her own, my older sister. She is very fond of, because she went back then, she said she was going to be a doctor. She was doing the self-breast examination and found a lump. Okay. We went to the hospital. Yes, it was taken out and sent for biopsy, but it wasn't cancerous. After about a year, we got into that habit. I started doing the breast self-examination, and I found a lump. I've had a
You
surgery.
see?
You did not teach me this, for my mom.
I'm not, don't mind for my mind's what she tells people. If
I don't know.
I'm
I'm surprised I never mentioned it to both of you, but I can show you if you
for the
want.
first time.
Do you want me to show? Can I show? I'll show you. So the sky is there.
Thank
So it
you.
was taken for biopsy and it wasn't cancerous as well.
Good.
So that has always been at the back of my head.
Yeah.
I know about it. They called it breast mouse.
Yes.
That's
yes.
what they called it. Yeah. So I had the surgery in SDA hospital in Aba in 2007.
So talking about this breast mouse and all that, we need to bear in mind that our breasts can be lumpy. Okay, how Pam Pam had a mammogram and said she had dense breasts. Some people have lumpy breasts, and that is normal for them. And the difficulty is, how do you know when one of the lumps has now become different? Again, back to my point, self-examination. You need to know what your breasts feel like so that when one of those lumpy things is no longer lumpy or feels different, your alarm bells start ringing. Okay, so self-examination. Okay, let's do a quick one on it. We're going to do it together. If you want to take yourself off camera, that's fine, but I want all of us to do it at the same time. So first of all, look in the mirror. Obviously, get undressed. Look in the mirror. Look, look at it. Turn to your left. Look at it in profile. Look at it in profile. Do put your hands on the back of your head like that, because that raises your chest wall and it goes up, and then look again. Put your hands on your waist and look again. Do some poses, but look very well. What are you looking for? Look for the shape of your breast, the contour. What does it look like? Is it remember, we're trying to know what our normal breast looks like.
Is this standing like Ijoma or dull like mama?
Like me.
Yeah.
Okay?
So at this time, people are checking their breast wherever they are.
Yes, I agree.
Can men do the same?
Yeah, of course.
Yeah,
Men.
yeah.
Okay.
So take off your camera. Yeah, take your camera off. And
so when we do, so now you've had a good look. What are you looking for? The shape, the color, especially if you're light skinned. Look for any patches, any redness. Just be looking. If you're dark skinned,
I always have those patches from this bra I'm wearing now. If I'm a body for me, it's always giving me wound. I'm telling you.
Okay.
The wire.
That is the point I'm
trying.
That's it. So now that is because you know your breast. So you now know that patch is from the wire. So that you can know when a different patch comes that is not from the wire.
Got you.
Okay. Check if you're dark skin, look for dark, patch discolorations. Okay. Have a look at your nipples. Look at your nipples in the mirror. Look at them very well. Most people's nipples are up, okay? But some people, they are inverted, but they will come out on stimulation if you're breastfeeding or if your
I wish you had pictures to show this breast. Next time we
see that you have ulterior motives.
Ebola is telling you how are you.
So look in the mirror, look at your nipple, okay? Remember, we're looking at normal, because if you are familiar with what your nipple looks like, the day you look in the mirror and actually the right one is looking funny, it's not coming out how it used to, there's something on it, you know that something is not right. So remember, we are trying to become familiar. We're trying to know what our normal breast looks like, okay? Yeah. And then, have a look at your armpits. Have a look at your armpits. Then go in the shower. The best time to self-examine is in the shower. All right. When you're all nicely soaked up. All right. And then let's say you want to do your left breast, with your left arm over at the back of your head, in your mind, split your breast into four quadrants. Okay, that is to be able to make sure that you actually feel the entire breast. It doesn't matter how large your breasts are, or how little. That is not the point. Just split it, okay, with the back of your hand like that, your 4 fingers. You then start pressing, whichever direction you want to take, but make sure you go around the 4. So the top, middle one, press, feel, low, press, feel, this way, press, feel, Go to the top left one, breast feel, okay? Then use your hand and sort of like cup it up and have a good feel. Just as much as you can cup up. If you have dense big breast, then feel, even if you can cup it twice, cup from here, cup it from here, yeah, but have a good feel, okay? And then go into your armpit, because there's something ccalled the tail. The breast tissue runs all the way there. Just have a feel, have a feel, have a feel, okay? Swap hands, and the same thing on the other side. Remember, split it into 4. Down there, there, cup it up, have a good feel, and then go into your armpit, have a good feel, okay? You don't have to do this every day. It will be confusing because remember, your breast is different. You can do it once or twice a month. But the important thing, just do it. Just have an idea what your normal breast looks like. Because one day as you're doing it, you're like, hang on, what's that? I can feel something. I can feel something. Then you get it checked out. Okay, so, and then it's not just doing it yourself. You can get, this is where your husbands, your boyfriends, your lovers, your partners can come in. When you're in bed, when you're having foreplay, let them have a feel of your boobs. Let them have let them play with it. Let them also be familiar with. They will.
Very important.
How many lumps have been picked up by husbands?
Yeah.
You would be surprised. Okay, let them have a good go. Let them have a look at your nipple. Let them suck. If they suck and say, babes, it's tasting different.
I won't get
have a press, okay? No matter how old you are, the last time you had a baby, most with enough stimulation, breast milk can come out, and the men know what it tastes like. The day it tastes different, they will tell you it tastes different. It's tasting sour, or they press it. You know what it looks like. Light white. Whatever. If it's beginning to look yellow, like pus or green or smelly or blood stained.
Oh.
Okay, please get it checked out. Okay, it is very important. So you've had a feel, or Oga has had a feel, and they've found something. There's a lump. Not every lump is breast cancer. Yes. Okay, just like Ify and Ego have identified. The fact that you have a lump doesn't mean it's the end of the world. It doesn't mean lots of this thing can be the mouse. It can be a blocked duct. It can be a boil. It can be a cyst, which is also very common. But I would rather you had it checked out and you were told it wasn't something dangerous than to think it was a boil or a cyst, like our sister Vera's mom, and then let it go. Remember, the earlier it is picked up, the better. I want to point out that not every painful breast is cancer. Most cancers are painless lumps. Oh. Painless lumps. When our breasts are sore and heavy, yes, that's actually normal. Remember, I said it's very sensitive to these hormones. So if your breasts are actually more sore than usual, they are heavier than usual or whatever, that's fine. Just make a mental note of when that happened. See what your period looks like. Check it again after your period. Most times it will settle after that, after the hormone levels have dropped. If after that is still painful, and it's still painful by your next cycle, then yes, go and get it checked out, okay? It's better for a doctor to now have a feel. Even if you've had a feel and you couldn't feel anything, let the doctor just have a feel, because the doctor most times will be able to tell when it is normal breast tissue that is, or if it is something else going on, okay? If it is a boil, still get it checked out, because there is a condition called inflammatory breast cancer. So these are the breast cancers that appear as if they are boils. And unfortunately, those ones don't have good outcome. So even if you have a boil in your breast, please see the doctor, because even if it's a boil, you're still going to need antibiotics or something. So still get it checked out, okay? It is always, safe what do they call it? It's safe, better
It's
to be
better to
safe
be-
than sorry.
I'm sorry, yeah.
Yes.
Safe to be-
Yeah. Yes, because when you have that and you go and the doctor has a look and say, oh yes, there's a lump, there's a this, there's that, they examine you. The most likely, even especially if they're not sure, every doctor will want to err on the side of caution and send you to have a scan. So in the UK, we have a special clinic called the breast clinic, and there they'll go and they'll do the scan. Fine, they do the scan and there's a lump. What happens next? This depends on, you know, what kind of lump it is, and you know, your treatment would depend on how far it has gone. So there's a lump there. There's chances are that they'll do a biopsy. So sometimes they might just put a needle in it. Sometimes just from the scan, they're able to tell that it's a cyst, or they do a needle and say it's nothing to worry about. Keep an eye on it. Keep an eye on it. We're going back to the first step, self-examination. Yes, you have a mouse, a breast lump there. Some doctors don't want to take them out. They'll leave, especially depending on the size. If it's so little, leave it. They'll say leave it. So you know that there's a lump there. Okay, you know it's the size of a pea. It's been there, they've had it checked or whatever. When you go to do your self-examination, you do. It's still there. It hasn't changed. It's whatever. 3 months later, you do it again. It's there. But actually, it's no longer the size of a pea. Now it's like the size of a cherry. Oh, actually, there's another one there. Get it checked out. You see what I mean? You are now familiar with your breasts. You know what's there already. You know what to watch out for. Okay. So now they've done this thing, and yes, it's not a cyst. Unfortunately, it's a lump. They've done the biopsy. Oh, it's come back this thing. So it's the decision of treatment will now depend on what kind of cancer, and there are lots of things they'll look into. So it's, you know, is it just in that lump alone? It's not spread beyond the lump. They'll probably just take out the lump. If it looks like it's spread a bit, they'll tell you, sister, maybe we should just take out the whole breast. Okay. It may have gone to the armpit, what we call the lymph nodes. They may want to clear it all out. It may have spread beyond. This is what we call metastatic breast cancer. Gone to the lungs, gone to the liver, gone to the brain. So they will want to know, maybe do as much surgery as possible, do chemo, do radiotherapy. These are now the women that are now fighting this battle. They have now been called to battle, and these are now the weapons that are, you know, you are still on reserve, but this person has gone to have, and then unfortunately they've been given the diagnosis, so the battle line is now drawn. So they go through all that, and then, like I said, depending, you can imagine if this woman went as soon as she saw that lump, and then it turns out all she needed was to just have the lump taken out. And maybe 1 or 2 rounds of chemo, compared to the woman who did not examine and then eventually goes, and it turns out that the lump has gone here, it has gone here, it has gone to the liver. Can you see where I'm coming from? Who do you think will have a better outcome? Who do you think will be among those 4 women that will still be with us in 10 years' time? Okay.
The one that
Pardon?
The one that checked early.
Yes, the self-examination, that is the greatest, that is our greatest weapon. Okay.
Ammo.
So yes, exactly. And then for those women who it's found to have like a hormonal factor to it, or this thing, they might give them hormone treatment. There's special medication they go on for like 5 years or so that blocks this breast tissue from responding to these hormones and all that. So have I talked about the inflammatory one? Those ones that look like boils. Yes. And remember, get them checked out. Yes. So I've ramped on for a bit.
Yeah.
Is there anything we've missed? Is there anything you'd like to draw attention to?
Yes. Question, like they say or believe that when the men do enough, that prevents prostrate. When men suck enough, does it stop breast cancer? And the doctor laughed. And the doctor laughed.
I won't get the laugh.
Yes.
I don't know where you get this thing. Is that on a curiosity question? Or is it
That's what we had.
That's what we had. It's been going around on social media.
When you're talking about prostate cancer or breast cancer,
what's
your question? So if your breasts are sucked enough.
Yes.
constant sucking, will it prevent breast cancer?
So that's an interesting question, because it will prevent breast cancer in the sense that it might be detected earlier.
Then, what does that
Okay.
mean?
The sucking mechanism, the sucking mechanism, or mechanism. If there's little lumps there, it wouldn't be,
It might help make them more obvious.
Yeah,
Your partner doing it will be able to feel if there's anything different, tastes different, looks different, might look at your nipple, and so that draws attention faster, because there's only so much you can see compared to somebody else. Which brings me to the other thing about weight.
If I might try to help you.
Yeah, Vera wants to say something, Fiola, before you go to weight.
Yes.
Sorry, I was going to say, I know that they say if you breastfeed, like your children, that it reduces the risk.
Yes.
So is that same as the adult one then?
No, so it reduces the risk, because remember that the more you are exposed to those hormones, the higher the risk. Okay, so the more pregnant you are, the no longer, how number of pregnancies you get. Remember, while pregnant, no period, so those hormones are less. And then remember, when you do have a baby and you're breastfeeding, most people will not have a period when they are breastfeeding. Do you know that? Yes. So we're talking about hormones now. So that is the reason for that.
Okay. Does that mean if we were to get rid of our womb, the risk will be reduced, or how does that work then? Because then it's not period.
No, no, good point. So if you have your womb taken out, a hysterectomy, alone, you still have your ovaries there. The hormones are triggered by the ovaries. So you will still have your hormones. But if you have a hysterectomy combined with what's called an oophorectomy, where they take out both ovaries, they will put you into instant premature menopause. And you would have to go on HRT because you no longer have those hormones. Okay. Yeah. I was going to talk about weight. I waited till we'd done the self-examination to bring up the weight thing. You know how I said weight is a factor. Remember how Pam talked about dense breasts and fatty breasts and all that. Remember, some people have boobs. It doesn't necessarily mean it's breast tissue. It could all be fat. And when you see them go on a crash diet or they go to the gym and suddenly henila dala because all the fat has gone up. That makes it easier to now actually feel the breast. So what am I trying to say? When you're doing your breast examination, if your breasts are full because of weight, because you are overweight and whatever, it is more difficult to get a feel compared to if you were slimmer and so that you have
and it's easily accessible.
What about slim people with big boobs? So they'll still have the same issues.
So those people is most likely that their breast is dense tissue rather than fatty tissue. So they are slim, but their breast is not fat. So this thing with them again is the breast self-examination. Again, is your familiarity with your breast. No matter how big your breasts are, you should be able to be familiar with it. Remember to split it into 4. Take your time and press it. Pick it up. Squeeze it. Have a good feel. Don't let the size be what is going to be your reason, okay? And have a low threshold for getting it checked. Have a low threshold for going to the doctors. Tell them that you're struggling to examine it properly. Can they have a feel for you? Because it feels, they will have a feel, all right? And then our sisters in Nigeria, if you do not have access to a national screening program, go and just have a scan yourself.
Yes.
Okay, just go and have a scan. I don't think it's that expensive. Just go and pay for a scan. If you have examined and you're not sure, give yourself a screen. Tell yourself, okay, every 2 years, I'll pay how many 1,000 and go have a screen for that peace of mind.
I think 2 years ago it was 70,000 or something like that. I don't remember.
Yeah, I mean, how much is a new phone? Just do it. Do it. There's nothing like peace of mind. And remember, if you have those risk factors we're talking about, your mom, your aunt, whatever, had breast cancer, you you remember, or you started having periods in primary school when Ifeoma started her own period in GS3, but your own started in primary
SS3.
6.
I started SS3, 17.
You see what I mean? So just have that at the back of your mind that, you know what, or I'm overweight, I'm struggling to feel my breast properly. Just go and have yourself a scan. Have that peace of mind, okay? Because remember, if it's picked up early, you have a better outcome. You'll be one of the 4 that'll be with us in 10 years' time.
Amen. Yeah. Vera, you have your hand up again. Guys, this topic is very close to your heart. Go ahead.
It is.
It is.
It is.
And to be fair, even before my mom's death, it's always been. I was gonna say in Nigeria, it's quite cheap. Well, I wouldn't say cheap, but it can be reasonable if you go through like a general hospital, and then they will refer you to the lab. So they have, or usually a lot of the general hospitals will have lab that they use, so they can refer you. It's not that expensive. I think on the scan itself, I think my mom only pays 16,000, and they detected it immediately.
16,000.
So it can be 16,000.
Yeah. 16,000.
16,000.
Yeah. I wanted
okay.
to add to that so many projects and there's so much noise around breast cancer in Nigeria now. So there's plenty of funds and so many projects are offering free screening, free treatment, and all of that.
Yes.
Some of them are sponsored locally, and some of them are people abroad who are sponsoring this project. I have some Kolia breast cancer. Kolia that was here. She has a project running where she's supporting people with breast cancer, they having access to treatment and all of that. Sandra, can we hear from
the only thing I was going to just add to that is a question where I was going to ask, you know how you mentioned about when it depends on when that person starts period and stuff. Does that mean that if you start late, you're higher risk, or if you start early, you're...
If you start early, you're at higher risk because you are getting the hormones earlier.
Okay.
What if you start early and have kids early? Like as when you start your period around 10 and you marry like around 18, 19 and have kids, would it reduce your risk?
The good thing would be if you started early, you had children early, you had many pregnancies, but remember that you won't, because of breast cancer, go and have 10 children. Okay, you need to apply wisdom. The main problem,
I heard though, as if he was pointing fingers.
Most of the times, okay, you see some women will have start periods early and they will end early. Okay. The worry is you start early, you started your period at 11, 12, 52, 53, you're still having periods. That is the problem.
All right. Thank you. Well, Sandra, sorry about that. Go ahead.
Hi, good afternoon, everyone.
Hello.
Good afternoon to the speaker. She made it as simplicity. There was nothing she didn't touch with. With simplicity, and I thank you very much, because we need to bring it home. We need to bring it back to home. We need to understand what is being said, how it's being said, how to apply.
Exactly.
I thank you very much. Simplicity, and that's the way to transfer knowledge.
Exactly.
Thank you, Sandra.
Yeah, Sandra, for your information, I mentored Fiola, the doctor, so carry on. So she learned from me.
No problem. Okay, so yes, thank you. So I am actually asking one question.
Yes.
I am in the kitchen.
That's okay.
Okay. So I am actually asking one question, and it puzzles me that we are having a lot of breast cancers than before.
Yes.
So right now where I am right now, they are actually zooming into those people that grow food. Right? They are actually zooming into
grow food, like the farmers, right?
Oh yeah, go on.
Farmers. Right. So they're actually zooming into it to know whether they are applying the right amount of pesticide, anything chemical.
Yeah.
Because the rate is really alarming. It's unbelievable.
Yeah.
And oh my God, even myself at the age of 40,
Yes.
I had to go and do mine, and they said it's dense.
Yes.
At the age
But where are you, Sandra?
You mean Jamaica?
I am in Jamaica, actually.
Jamaica. Oh, okay.
Yeah. Yes.
Yeah.
Sorry, and
Right.
Sandra,
So
you're from Uguta, right?
yes. So
It could be that the dense breast is from Uguta.
It's something in the water. Something in the water. Yeah. So sorry. So what's your question, Sandra? Or is it
so my question is like, by any chance, do you think it has anything to do with
food?
Okay.
And the way we grow food today?
Yeah. So the thing with cancer is that the risk factors, the things that we mentioned, are nowhere exhaustive. Okay, we can go on and on and on. A serious this thing in all breast cancer is what we call environmental factors. So I didn't really press on that because of time. So it does play a role, but you cannot compare that to the family history one and the importance of self-examination. So when you talk about environmental factors, we're talking about something we call carcinogens. So these are things that make you, that can, trigger the cancer cells. Because what are cancer cells? These are cells in the body that just start growing out of, they just lose control. So yes, so carcinogens can be anything, including, I do not think there's a direct relationship with food. I may be wrong. We may never say never in medicine and science, but there is a direct relationship with pesticides. Okay. Yes.
All
with
right.
Pesticides.
Yeah.
Yes. So you are absolutely correct with that.
Think so.
Yes.
Yeah, because they spray a lot of pesticides on these fruits and vegetables, and then they tell us to eat right. Then you go and take those fruits and vegetables and eat it, and shit happens. Oh no, we can win with this.
Thank you. Thank you very much.
I mean, if we take nothing home today, let us remember self-examination. Okay. Yes. Let us remember the risk factors. That lady I told you that her sister was had a lump and they told her to go. She never smoked. She never drank alcohol. She was never on the contraceptive pill. She started her periods like 14 or 15. You see, she did not. So you see what I'm saying? So remember the avoidable and the things you can help and the things you can't help. She did everything she could, humanly possible. But unfortunately, family history was the one that caught her out. And she was diagnosed at age 32 and she died at age 38. Okay, so just bear in mind, there is a war out there. Okay, what we've done today is I've given us our weapons to be on standby. Yes, everything is on standby for you. And if God forbid you are called to battle, you are this thing, you need to have all these things available, So if you are doing the self-examination and it was picked up early, you have a family history, listen, go and pay for 16,000 and have that scan. Go and, whatever. Don't smoke. Cut down your alcohol. Keep fit. Don't be unnecessarily overweight so that it's difficult to find stuff. Okay? Be watchful. All these things are important. Let us be among those 4 women that will be here in 10 years' time. Okay?
Sir, Vera's hand is still up. Vera.
No, sorry. I just wanted to add a very, very quick one to say, with a comment that there's been a lot of breast cancer lately. Yes. I think what we've got to realize is that medicine is growing and it's developing, and a lot of these things that would not have picked up like 2 years ago, we cannot pick them up. So a lot of the time, in the past, people will die, and in Africa, we'll just blame it to that woman
Juju,
said
the remote control.
Exactly.
Or village people.
Yeah, the after
then...
meal, the after informer. If you know the people after informer,
or they go to Odumeje and
you know the people after informer.
we'll catch them. Take care of them.
That is so
Yeah.
true. I mean, I had a work colleague who was very, very amazing, and she was ill last year in end of April, 28th of April to be precise. She went off work and went into hospital, and in May she was gone. Breast
Yeah.
cancer. And again, like we'll say, Nigerian people, but this is Oyinbo, like she lives here in England, and you know, but again, diagnosed late because she didn't pick it up. So those weapons that Fiola has given us tonight, I think we should really work on them and take them on board because they're really important. Regardless of how good medical services is where you are, if it's not detected early. Then it's of no use.
Absolutely. And going back to what you said, Vera, it is looking as if breast cancer is everywhere now, but the truth is that the awareness is higher now. So people are coming, and it can be an increased workload for doctors because people are now even paranoid. You know, this one, that one, they go and get it checked out. Before, if you had a breast lump and you told the doctor will say, where are you in your cycle? And you said, they'll say, okay, wait, after your period, if it's still there, come back. But now the awareness is such that if you have like I said, if you are self-aware, you know exactly what your breast feels like, and you feel something is there, just get it checked out. Let them tell you it's nothing to worry about. Then so people are doing that, you know, more and more and more. So let's say some people that would not have thought twice about this, people are now coming forward, and the diagnosis is getting, you know, so that's why it's looking as if it's more this thing, but it is a good thing. It is a good thing because this battle needs to be fought and it needs to be won.
You need to win, man.
Yes, because remember, in dedication to those ones who have fought for us and have set this path for us.
Yeah.
Okay.
Okay. Is there anyone that wants to ask my mentee any question? Dr. Fiola? They'll be wondering why I mentored a medical doctor because I could not do it myself. I took it upon myself to mentor a medical doctor. In the absence of that, I would say, Fiola, thank you very much. As always, when you speak to us, you give it to us as it is. Yes. The most important thing for us today and what I've taken on board is know your breast. Now when I know,
if you don't know anything, know that one.
There's no shame in that.
I saw what you sent me. Thank you.
Know your breast. I know my breast, right? Very well. It is important. It is not a sin to know your breast.
Yes.
If in your head you think that when you're doing that examination you're masturbating, go ahead and feel it. But the end result is knowing your breast. It is important because if you don't know what it looks like, when something happens there, you cannot tell the difference. Exactly. And that's when you go to doctor and you tell the doctor, oh, when did you notice? I can't even remember. Exactly. Yeah. Like that, I can't even remember. We are too enlightened. We're too exposed to be stupid. It's all a big thing. Know your breast. There are so many parts of the body that we need to know, but the most important one is if you cannot know your breast, tell your partner to know your breast on your behalf. But again, you need to know your breast. Correct. It's important. Very well. So today's topic is about breast awareness because of things that will happen in your breast. A lot of things. Breast cancer is a big deal. It is a big deal. So many breasts you see out there is now built breast because they've gone through breast cancer and their natural breast has been taken off. Again, some people are still battling the disease, they call it. But one interesting thing for me and one thing that makes my mind at rest is these things are being dealt with now, especially when it's being caught early. I've seen somebody who's had the breast cancer. If you see her today, unless she tells you, you wouldn't believe it happened. No. It was caught early. She fought it, and she is back to herself.
Yeah.
Exactly. Thank you.
So those that lost their lives, we miss you all, and we say, may God accept your soul. May you continue to rest in the Lord, in the bosom of our Lord Jesus Christ. We are here, and thank you to Fiola, doctors and scientists out there, pharmacists, all of you in the medical field. Thank you for working very hard to find the medication and keep developing medicines and things that you need to do. For us, who are not in that field, for everybody that has a breast, Be you a man.
As long as you have
man,
breast.
please know your breast. I like that statement. Know your breast. It is important. Just
be best friends. Be best friends with your breast. Keep touching it. However you want to carry them, push them.
And just a pointer. If I mention this thing, if you have breast implants, it will not protect you from breast cancer because you still have breast tissue there. Again, it goes back to know your breast. Know what your implant feels like. Know what the normal breast under it feels like. Just be familiar with it, because if something feels different, just get it checked.
Yeah.
Holla at your doctor.
Yeah. Thank you very much. So, and again, you have to check if you have a dense breast or fatty breast. Whatever you have, manage it well. We're
Please,
going offline.
Share the video of this session. Please share it.
Oh, yes. Please don't forget. Once you get the link, go on Facebook, share it to your friends. This is an important information. And thanks for the testimony that people that listen to Fiola, they could tell that Fiola passed down the message easily and swiftly. So who cannot understand Fiola today will never understand it. It was very simple. Product of St. Joseph's College, now we did. Thank you very much. We're going offline, but if you have a moment, you can still say and have a chat.